Hello everyone, welcome back to our channel. Today we're talking about asthma. Asthma is a common condition that affects the airways in your lungs. It can make breathing difficult and cause coughing, wheezing, and shortness of breath. But don't worry, we're here to help you understand what triggers asthma and how you can treat it. Let's get started. What is asthma? First, let's talk about what asthma is. Asthma is a chronic condition that affects the airways in your lungs. These airways are tubes that carry air in and out of your lungs. When you have asthma, your airways can become inflamed and narrow, making it hard to breathe. This can happen when you're exposed to certain triggers or during an asthma attack. Asthma is not the same for everyone. Some people might have mild symptoms, while others can have severe symptoms that interfere with their daily life. It's important to understand what triggers your asthma and how to manage it. Common symptoms of asthma. Now let's look at the common symptoms of asthma. Knowing these symptoms can help you recognize an asthma attack and take action quickly. The most common symptoms of asthma include coughing, especially at night or early in the morning, wheezing, which is a whistling sound when you breathe, shortness of breath, and chest tightness. These symptoms can vary from person to person and can change over time. Sometimes you might have one symptom more than others. Triggers of asthma. Next, let's talk about what can trigger asthma symptoms. Triggers are things that can cause your asthma symptoms to flare up or make an asthma attack more likely. Common triggers include allergens like pollen, dust mites, mold, pet dander, and strong odors or fumes from perfumes or cleaning products. Exercise, especially in cold, dry air, can also trigger asthma symptoms. Respiratory infections, like the cold or flu, and strong emotions, like stress or excitement, can also cause symptoms to flare up. It's important to identify your triggers so you can avoid them as much as possible. Keeping a diary of your symptoms and what you were doing when they occurred can help you figure out what your triggers are. Diagnosing asthma. If you think you have asthma, it's important to see a doctor for a proper diagnosis. Diagnosing asthma usually involves a few tests. First, your doctor will ask about your symptoms and medical history. They might also do a physical exam to check your lungs and airways. One common test is a spirometry test, which measures how much air you can breathe in and out and how fast you can blow air out. Other tests might include a peak flow test, which measures how fast you can blow air out, and allergy tests to see if you have any allergies that might be triggering your asthma. Treatments for asthma. The most common treatment for asthma is medication. There are two main types of asthma medications: long-term control medications and quick relief medications. Long-term control medications are taken every day to keep your asthma under control and prevent symptoms. These might include inhaled corticosteroids, which reduce inflammation in your airways, and long-acting beta agonists, which help open up your airways. Quick relief medications, also known as rescue inhalers, are used to relieve symptoms quickly during an asthma attack. These medications work by relaxing the muscles around your airways so you can breathe easier. Asthma Action Plan. One of the best ways to manage your asthma is to have an asthma action plan. An asthma action plan is a written plan that you create with your doctor. It helps you manage your asthma on a daily basis and know what to do if your symptoms get worse. Your asthma action plan will include information on your medications, what to do when you have symptoms, and when to seek medical help. It will also have steps to take if your symptoms get worse or if you have an asthma attack. Living with asthma. Living with asthma can be challenging, but with the right management, you can lead a healthy and active life. Take your medications as prescribed by your doctor, even when you feel fine, to keep your asthma under control. Avoid triggers like pollen, dust, and pet dander by making changes to your home and being mindful of your environment. Stay active with exercises that are right for you, consulting your doctor to determine the best options. Finally, work closely with your doctor asking questions and sharing concerns to ensure you're receiving the best care possible. If you found this video helpful, please give it a thumbs up and share it with others who might benefit from this information. Don't forget to subscribe to our channel for more health tips and information. Thanks for watching and take care.